Creutzfeldts-Jakobs Disease. This disease is much like other neurodegenerative diseases. Neurodegenerative diseases are a brain disease that slowly destroys certain parts of the brain. Creutzfeldts-Jakobs disease usually leads to a coma and eventually death. It is caused by an abnormal infectious protein in the brain called a prion. Prions were first discovered in 1982 by Dr. Stanley B. Prusiner at the University of California, San Francisco. By purifying an infectious agent and discovering the prion, he later won a Nobel Prize in medicine later on because of that discovery. Creutzfeldts-Jakobs disease affects about 1 person out of every million people yearly. It is a rare and fatal disorder that affects 300 people a year in America. It occurs later in life and runs an extremely rapid course compared to the majority of the rest of neurodegenerative diseases that usually take years and even decades until you meet your fate, as compared to Creutzfeldts-Jakobs disease that can be as short as 4 months or as long as 2 years from diagnosis. Symptoms can start at an onset at about 60 years old. There are 3 different types of transmission or ways to contract this disease. It can be sporadic, which means completely random, or if you had a family history of this disease in your family, you have a much bigger chance of contracting this disease. It is also believed that it is possible to contract it when you may have ingested the brain of an animal with the same abnormal prions in the brain, or coming in contact with certain brain tissues, usually through certain medical procedures. No sufficient evidence suggests that it is possible to be transferred with just regular everyday contact with other humans. Prions are a completely natural thing. In fact, it is found throughout your whole body. These are abnormal prions that fold out of their regular structure, rendering the purpose of these proteins useless and morphing them into a new and not natural flat structure that infect other proteins rapidly and eventually make the surrounding brain cells useless. It is diagnosed by ruling out other symptoms from the other diseases who have similar symptoms as Creutzfeldts-Jakobs disease, such as Alzheimer's, Parkinson's disease, or a brain tumor. Although like Alzheimer's, it cannot be diagnosed officially until post-mortem or after death, doing a brain biopsy and looking for these particular proteins. Signs and symptoms of this disease include anxiety, depression, memory loss, impaired thinking, blurred vision, insomnia or the inability to sleep, difficulty speaking, difficulty swallowing, chorea, or sudden jerky movements, usually in the face, shoulders, and hips, personality change, and hostility. There are no known cures of right now, but several societies are working to find possible cures, like the National Prion Clinic. Treatments include making the patient as comfortable as possible and reducing the symptoms with medications like sedatives and antidepressants to reduce anxiety and depression, or clonazepam as sodium valproate to reduce muscle jerks or tremors. There aren't many risk factors in this because it is usually sporadic or genetic, but with surgery you can't reuse the tools in surgery, but it is a normality in most modern hospitals to dispose of used materials. Other than that, try to live healthy and hope you don't get this very rare disease. For further reading, visit the cjdfoundation.org or http@nhs.uk conditions Creutzfeldts-Jakobs disease.